Welcome back to Suncoast FYI. I'm Melissa Warren. Do you have aches and pains in your joints? What if your own body held the answer to reducing your pain? Dr. John Greco is working to find the answers to these questions and joins me now. Welcome, doctor.
Thank you. It's great to be here.
I'm curious, you're talking about joint pain and osteoarthritis. What exactly is osteoarthritis?
Well, osteoarthritis used to be called degenerative arthritis, and what it is it's wearing down the cartilage. Our cartilage is being worn down faster than it's being reproduced, so we have net loss of cartilage.
Gotcha. So what is the usual course for this? How does it happen?
First of all, there's 27 million Americans right now with osteoarthritis. Half of us will have osteoarthritis symptoms of our knees in our lifetime. The usual course usually starts like in mid-40s. For me, it started my left knee just getting Christmas decorations. I'd run up and down the steps. It would swell up, calm down in a couple days. But what usually happens then, it gets progressively worse. It comes on more often, lasts longer, and gets more severe. Eventually, it's constant, and eventually the cartilage may wear out completely and surgery may be needed, medications and such.
Right, so I'm wondering, you say it kind of comes on at first, you might not even notice what it is because you think maybe I just, pull my knee or something like that. Is there any benefit to catching it early and to begin treating it early?
Well, what we do, yes, we believe it is important. Usually, though, what happens with most people is they'll start taking some Tylenol or they'll start taking something like anti-inflammatories like Motrin, Naprosyn. And a lot of people take those, which is a little scary because people don't realize that American Journal of Medicine estimated that about 107,000 admissions a year for GI bleeds from anti-inflammatories, and there's about 16,000 deaths a year from anti-inflammatories. Other treatments, people can get steroid injections in the knees. They are a temporary fix, and actually if you get too much of them, then you can actually harm the cartilage. Then the next step oftentimes is hyaluronic acid or Synvisc. Some people recognize it as rooster comb. In mild cases that will help, but unfortunately it really doesn't do anything. The Annals of Internal Medicine, a well-respected journal, 2012 looked at 26 studies, 13,000 patients, said it did nothing. So despite what you may read in newspapers or on TV of an FDA-approved breakthrough treatment for arthritis in the knees, it really doesn't work, and it doesn't prevent surgery. Then people go on, and narcotics may be needed, and we can see the problems with narcotics. 50% of people that get on narcotics never get off them. And the last resort is surgery, and some people, the disease is so bad they need to go to surgery, but that's something that we should really try to avoid because some of the side effects of surgeries are perioperative heart attacks and strokes. You may get blood clots in your legs, blood clots that may go to your lungs. And the two that really scare me are infection. If a joint becomes infected, the joint has to be taken out, the IV antibiotics for 6 weeks, then another surgery, put another one in. Or most importantly is persistent pain. Some studies, between 6 and 30% of the people who have a knee replacement still have pain. So we want to try to keep our own joints, our own natural joints as long as possible because we can't build a joint like we already have.
Gotcha. So you're talking about a lot of the bad maybe side effects of some of these treatments. I'm curious, how do you treat osteoarthritis?
Well, we try to avoid medications. We try to treat it naturally. We have 3 goals. One is we want to decrease pain and decrease inflammation. 2 is we want to increase mobility because we want to keep people active. When people don't move, they fall apart. Thirdly, we're trying to grow new cartilage. So I practice regenerative medicine, which is essentially your body healing itself, using your own body to heal itself. There's several different ways. The mainstay of it is platelet-rich plasma, where we actually have a proprietary form of it called cytokine-rich plasma, where we take, say, 60 to 120 mLs of the patient's own blood, we process it, and we extract the messengers, the growth factors and cytokines that tell other cells what to do. They decrease swelling and inflammation, and they initiate the healing process. And we've been very successful with it, especially with knees. We have patients that are bone on bone. 6 years ago, they were told they needed knee surgery, and they're fine with their own joints. They just had injections. It's something that really should be pursued. Instead of jumping right to surgery, you really should try to cool down your inflammation and do it naturally. And in the rare instance when the CRP doesn't work, other options are stem cell treatments. You can do stem cell treatments with fat transfers or bone marrow, but I don't particularly like those options. Some of the things that are coming in the future, are actually here right now, are amniotic tissue implants, where they will take the placenta from pre-screened women, and they will take the amniotic fluid, and these are full-term births, and they will take the amniotic fluid and membranes and extract them, process that, and we can use them because it's very high in stem cells. For example, my mom's 95 years old. She has a bad shoulder, bad back, and I injected her with CRP about a year and a half ago, and really didn't do anything for her. She's so old, at 95, she doesn't have a lot of stem cells left. And right before Christmas, she had a compression fracture in her back, and it actually put her in the hospital, and she was put on narcotics and came home bedridden, could barely even open her eyes. And so we injected her with the amniotic tissue implant in her back and her shoulder, and left and came back down here. And I got a call from my sister on New Year's Eve. And somebody wants to talk to you, and Mom, and she says, I'm feeling great, I have no pain, I'm gonna have a couple beers tonight. I'm like, wow, this is pretty amazing. So the bottom line is there's options, and those treatments that I'm talking about come from our own bodies. And I always like to say our bodies are amazing. Why is it so surprising that the answer to our problems are already inside us?
All right, well, that's very interesting. It's amazing to see what can be done with what's in our own bodies. Thank you so much for joining us.
Thank you. It was
really
great being here.
appreciate it.